team-based special surgical situation. In that modifier 62 two surgeon. When the surgery is performed by the two surgeon, in that cases we have to give 62 modifier. Next 63 modifier procedure on infant less than the 4 kg. Okay, 4 kg or less than 4 kg. When the procedure is performed on the infant, okay, whose weight is less than 4 kg, we have to give the 63 modifier for that. 66 modifier surgical team. When the team is performing the surgery, in that cases we have to give 66 modifier. 76 repeat procedure by the same physician. When the procedure is repeated by the same physician, in that cases we have to give 76 modifier. 79 unplanned return to the OR. OR means operating room during the post-operative period. When unplanned means if in the previous procedure is done in this post-operative period, uh, the patient is coming for the operating room due to some another or same problem. Okay, when it is unplanned, in that cases we have to give 79 modifier. 59 distinct procedural services. So distinct procedural services means which is the distinct from another procedure services. In that cases we have to give 59 modifier. Next is rehab and multiple uses. 96 habilitative services. For that, teach new skill function or speech for the children or any habitative service is given. In that cases we have to give 96 modifier. 97 rehabilitative services. When patient is addictive to any other substance like for example alcohol, nicotine, tobacco, or any other abusive drugs like cocaine, heroin, morphine, in that cases we have to give 96 modifier. 97 modifier for the rehabilitative services. 90 multiple modifiers. When we are giving the multiple modifiers, in that cases we have to give 90 modifier for the multiple here is some mistake is there. 99 modifier for the multiple modifiers. Okay, next is ENM. ENM means nothing but evaluation and management. Okay, and QHCP means qualified healthcare professional. Okay, that is the alternative for the physician. In depth we are going to study the modifiers. 22 modifier increase procedure. Previously also we discussed about that. When the time, work and intensity is increased, in that cases we have to give 22 modifier. Increase procedure services. Work required was substantial greater than the typical required. The physician performed the extra works due to complication or unusual circumstances required the additional time and effort. Okay, in simple language, when increase in time, work and intensity, we have to give 22 modifier. Example is given: routine appendectomy with the severe inflammation requires the additional time and effort. Due to severe inflammation, the time is increased and effort is increased. That's why we are giving the 22 modifier. Okay, keyword here is extra time, took longer time than normal, additional time, okay, and any additional work. Unusual anesthesia, for that we have to give 23 modifier. For the unusual anesthesia applied when the procedure that typically does not require anesthesia or would usually requires the local anesthesia or no anesthesia, but due to circumstances, unusual circumstances, we have to give general anesthesia. In some cases the anesthesia is not required, but the patient is not ready to do the surgery without the anesthesia. In that cases local anesthesia is also applied. For that also we have to give 23 modifier. Patient with severe anxiety, example is here. Okay, uncooperative patient requires the general anesthesia for the minor surgery. Okay, in majority cases you will see the general anesthesia is given, which is not necessary, but due to circumstances or due to any necessity we have to giving the anesthesia. In that cases 23 modifier is applied. And the guideline is for that we have to give only in anesthesia code. Okay, this modifier goes only with the anesthesia code. 24 modifier unrelated E&M service during the post-operative period when the surgery is done and patient is on post-operative period. In that cases, if different disease condition occur or some complication occur which is not related to previous operation or surgery, okay, in that cases we have to give 24 modifier for the unrelated E&M service. E&M service was for the condition entirely unrelated to the original procedure and used when the physician sees the patient for the new or different issue. Example is given in the post-operative period. Operation is done of some other reason and the patient is uh, here for the ear infection which is unrelated to previous surgery. Keywords are there: unrelated, not related to, unrelated E&M services. Next modifier is modifier 25, separate E&M on the same day. Okay, which is significant separately identified E&M service on the same day, same physician, okay, in procedure or service on the same day. The E&M service provided is a distinct from any procedure performed on the same day, used when the physician address a new different issue than the another procedure. Example is given: routine follow-up visit. A physician identify that treats the unrelated issue, that is the ear infection, bill with the modified 25 for the separate E&M service. The keyword are separate E&M outside of unrelated. Okay, in previous slide also we discussed about the modified 25. In three different scenario we have to use this 25 modifier when the outpatient and inpatient E&M service is done. In that cases, for the outpatient services we have to give 25 modifier. When any E&M service and CPT code or procedure is done, we have to give 25 modifier for the E&M service and code the separate CPT code. The third scenario is the decision of surgery for the minor surgery. In that cases we have to give 25 modifier. Okay, because 25 modifier lots of time it is coming in the question, so you have to remember this point when we have to use the 25 modifier. 26 professional component, in that only interpretation is given. Okay, the test is not performed or not given the procedure, only it is giving the interpretation. In definition, professional component, physician provide the interpretation, supervision or written report for the test or procedure, do not perform the actual technical part. Okay, the technical part is done by the another provider. For example, radiologist interprets the x-ray taken at the hospital. The x-ray was taken by the hospital and radiologist just interpreting. Okay, so for the radiologist, CPT code with the 26 modifier, and for the hospital, technical component which is TC. Cardiologist interpreted ECG performed by the technical, okay, by the technician. ECG is performed and cardiologist just interpreting. For that we have to give the 26 modifier for the professional component of cardiologist with the CPT code and hospital technical. Keyword: professional component, interpretation, when not to use the 26 modifier. Okay, you, you have to see crystal clear difference between when to use or when not to use. Cardiologist in private practice takes and uh, interprets x-ray in the office. Why not to use? Physician perform the both technical and professional interpretation component. Bill CPT with owns bill CPT without the modifier 26. When cardiologist is just performing, okay, when 26 is not used means if the same hospital equipment from the same hospital, okay, and the provider is from the same facility or same hospital, in that cases all the procedure is done which is the bundle in that hospital only. So the service given by the hospital which is a bundle. Okay, so in that cases we cannot give 26 or TC modifier. Mandated services which is mandated by the third party like insurance, court or uh, any other